Malawi was facing some very, very poor health conditions and a real lack of skills training. The best thing we could do if we were going to come to a country as a team from America is to bring skills, education, and training to everything that we do. It's not enough to come in and provide a service. The emphasis was on helping them do the work.
Isanabwere child legacy kunoku anthu mavuto adalipo ndithu kumbali ya chipatala. Ku child legacy jaitabwera yonse kuti kudera linoli yapapuza kwa mavuto kumbali ya zaumoyo.
So we came here and we started with an outpatient facility, and it's evolved now into a full functioning community hospital, and we have superseded our own expectations. There was nothing here, not a thing. And we lived in a tent for 2 years as a family. But what it allowed us to do was to work hand in hand with the community. So we got closer with them. We communicated almost on a daily basis with the local chiefs. We have one traditional authority, T.A. Musa Makunda. He would come here all the time and just sit and have a Coca-Cola with us. And he would say, "What do you need, Jeff?"
Lord Jesse, ndakudzika naye kwambiri kuti ndithandizane naye. Pachifukwa kuti Lord Jesse adakudzika kwambiri aluyenda mkati mwa midzi mmene anthu akuzunzikira. Lord Jesse ntati ndimuthandize koma kuti niyitanitse mafumu magulupu tikhale pansi.
He would bring volunteers and make bricks, and he'd bring sand, and he was also instrumental in making sure that the community was involved in building their first hospital. It was very important for us that if we were going to do a project in Malawi, that we were going to bring in sustainable energy. We'd realized that the national grid here was completely inadequate. So this hospital is powered by solar and wind. We have a large series of lights that come on at dusk. All of a sudden, street lights were coming on, outside lights were coming on at dusk. So the community was calling it a place of light. From that also stemmed a very high quality of health care, which relates to a place of hope.
The difference between Child Legacy and other normal hospitals in Malawi, we don't have any challenge of power because we have power every day, always. And this motivates our staff because if you go to work and everything that you're supposed to use is there available, you enjoy your work in the right way. A Child Legacy Health is an integration program. We integrate health program with agriculture. Though our main focus is maternal and child health, we want to transform the environment at the same time having a healthy baby. So we give out a tree when a woman delivers, goes home, and we follow up trees with agriculture group. So when we go in the field with agriculture group, they'll check on the trees, the way the tree is growing.
One of the reasons that Malawi faces the highest number of stunted growths under the age of 5 is because of the poor nutrition base. Diversifying your crop base and your food base is so important. So the food and the health side, the way we're integrating all of that in, we have 8 big fish ponds. It's a commodity that we can sell. The money goes back into our healthcare services. We have large agricultural development here where the crops that we grow provides a food for our staff and for our patient. Everything that we do here is really based on a holistic, organic approach that feeds back into the community and into the project. Child legacy is about showing you what your legacy can be. So I try to encourage people to realize that their dreams and destinies really lie in their hands.
Child Legacy is the dream that is alive. It's healthcare in a rural area using renewable energy and saving lives.